Good afternoon, everyone. Good afternoon. Um, I've spent 20 years in special forces, and as everyone knows, we carry some pretty heavy loads. Kevin's certainly aware of that. Essentially, my spine was straight and forward, and loss of balance, falling a lot, numbness in the arms, dropping glasses all the time. Um, uh, if I'm holding a cup of coffee, it could slip and drop at any moment, and I didn't know it. And constant headaches. Um, so I was on the morphine, the Vicodin, Lyrica, the same kind of meds that most of you are familiar with. And I've got some other issues that I'm still on that once I get those straightened out. But I will tell you that I've had significant improvement um, since in the last 2 weeks. I haven't fallen. This last week, I didn't get any migraine headaches. And so that's a blessing in and of itself. And the pain in my neck has decreased exponentially uh, compared to prior use of the collar. Um, so it's done a lot in just 2 weeks as far as I'm concerned, and I'm really looking forward to what it looks like after 10 weeks. And so if you take a look at my fulcrum, and then you can see it's pushed in a little bit more to provide a little more pressure on that part of my spot, my C spine. And I have had C spine fusion, C4, C5, C6, but that was before. Excuse me, that was before they had the all the hardware that they would put in the C spine. I think most of us in the military, we come from the same place. We're carrying loads that the body wasn't designed to carry over terrain that we weren't designed to be the pack mule for. And so we've all got that leaning forward posture, especially like when it takes two other soldiers to help you get up off the ground to carry your pack. And that was the norm. That wasn't a rare instance. That was quite normal. So let me show you how this goes on. And you're going to put it on just like you would a helmet, kind of, if you're playing football. And I like to slide it in. And for me, I get it straight to where it's flush. I like to get it okay. I go back right now 6. One more. Okay, so that's back 6. And from side view, this is what it looks like. And when you lean back just a little bit, that's how you're going to sit for 20 minutes. And it's just pressure, no pain. This is important. I was afraid when I first saw the fulcrum that I was going to get a lot of pain. And fortunately, I did not. And so it's just pressure. But the reduction in the numbness in the hands, and the reduction in the neck pain, and reduction in the headaches, and loss of control with holding stuff in my hand. My wife's very happy that I'm not breaking glasses anymore. I've had significant balance issues, and you're all familiar with it feels like when a disc moves and it kind of stops you dead in your track. Kind of like that, Kevin. Yeah. It's painful and it almost immobilizes you. I haven't had that since I started wearing the collar. And we're going to follow this for 10 weeks through the whole process, but so far so good. I'm happy with this, with the near-term results. and I'm really looking forward to what it looks like at the end.
Service veteran that needs a Cervigard.
Other veterans.
Other veterans.
Like yourself.
Like yourself. All right, bring your head back. Back. Okay. So now I'm going to go over the shoulders. I'm going to try and push your shoulder down a little bit, all right? Is that comfortable? Mm-hmm. All right, so now the chin pad goes right there. Okay. So now...
You're in the way, I can't.
Sorry. Okay. So all I've done was I advanced the roller on one side just to close the gate. So now I'm going to push his shoulder down. I'm going to push both shoulders back. And I'm going to start rolling the rollers at the same time. How's that, Dad? Good.
All right, now notice the cheek pads, Dennis. As they start to spread, you're meeting the wall of resistance. So, Dad, if you can take the
right side. A little pain on the right side, okay?
How many notches are you back on the track, Dennis?
So I'm at the doorway to a third click.
Okay. Dennis, is that the maximum pressure you can take?
Dad, is that the most you can take, or can you take a little bit more pressure?
I can take a little more.
All right, stay there.
You're going to have more tolerance than the right. So we're on the third click on both. Is that too tight?
No, that's fine.
All right, great.
Yeah.
And your chin, oh yeah, you got plenty of space on your chin, so that's good.
Okay, so we got around 3 notches back on the collar. We've lowered the right cheek pad, the pad itself, about a ½ inch to give clearance because Dennis has a high right shoulder. Can I see a side view of Dennis, Mrs. LaRosa? Okay, so now Dennis Jr., can you just gently push Dad's head back a little bit? See if it bothers him to do that. Let's see how much we can get. All right, Dennis, how's that going?
How's that for pain?
Okay.
All right, so if we could do that, now we get more advantage with that.
Then the right side, under my eye.
Well, that's where the pressure is, because of your shoulder blade.
So, Dennis, the pressure on the cheeks is the pressure of the Cervigard collar pushing your head rearward over your shoulders to reduce the forward head posture.
Yeah, the pressure on your cheeks is pushing your head back, which is reducing your forward head position.
I think that's great. And with a little bit of, his head is just dangling there, but I guess the tension in the paraspinal connective tissues is just holding his head up like that.
Yeah, exactly.
Now, one of the things we could do when they do come for the x-rays, Dennis Jr., if I may call you that.
Sure, of course.
Take the x-ray with the collar on and without the collar in the maximized position. That way we can see the delta over time.
Sure. Okay.
Not that we have to keep taking a lot of x-rays, but it would be good to take one with the collar fully adjusted and compare it to the status of his head and neck curve prior to putting the collar on.
All right, you got it.
Hello, my name is Lisa Manella. I'm a registered nurse for 25 years, and I have had neck pain since I'm about 18 years old. I had surgery about 10 years ago and since has failed. And since I've been coming and wearing the collar for the past month, I have probably about 80% better, maybe 90%.
So Lisa, what were the symptoms? This is Dr. Ron Delano. What were your symptoms that you described prior to the treatment with the Cervigard forward head posture correction collar?
I had neck pain. I had arm pain with numbness in my right arm. I had subclavicular pain and also shoulder pain. And
your pain between the shoulder blades as well, right?
Yes.
Okay. All right, so how are all those pains are responding nicely?
Yes, tremendously.
Okay. And what would you say about in terms of recommending this for patients?
I would recommend this to anybody. This is the most pain-free I have ever been in 40 years.
Thank you, Lisa.